It promotes full lung expansion. If they can tolerate high Fowlers when they're short of breath, the better it is for them. Okay, typically 60-degree would be okay. Most patients, they are not able to tolerate a 90-degree elevation of the head. Okay, like what we're doing right now, we're sitting up. This is a 90-degree. So this is best for people with respiratory issues, people with short of breath. Semi-Fowlers, which is 30 degrees. Okay, so remember, semi is 30, Fowler is 45 to 60, high Fowlers is 90. Okay, I might test you in this one. Now, for patients who can't tolerate Fowler's position, you can put them on a semi-Fowler's position. Okay, and this is also a position ordered after a lumbar puncture. Okay, so there are some controversies on this one, but typically after a lumbar puncture, we want to put them supine for a few hours to minimize what we call as a post-puncture headache. Okay, when there is a leak in the cerebrospinal fluid during this procedure, okay, it can cause a terrible headache. So the best way is to put the patient flat on the bed, meaning on a supine position. Trendelenburg, don't get confused. I may ask you a question about this as well. What is, in terms of your references, when you say Trendelenburg, which one is higher, the head or the foot?
The foot.
The foot.
Which would be elevated on a Trendelenburg position?
The foot would be
Foot.
more up.
Okay, so the entire bed is tilted downward toward the hub, meaning the head of the bed, okay, with no break in the middle of the bed. There will be no break. It's going to be flat, okay, and the bed is tilted downward towards the head, okay. What about a reverse Trendelenburg? Okay, so the downward tilt is towards the foot. Okay, so you don't get confused. That's reverse Trendelenburg. This is Trendelenburg position. Okay, so when do we apply this one? Although this is not encouraged, especially in clinical practice now, there's a lot of controversies on this one as well. But it facilitates the removal of secretions with postural drainage. That's number one. Okay, if there is poor venous return in the patient, okay, meaning there is edema on the leg, okay, that means there is no, the return of the blood to the heart is very poor, okay, we can use this position as well, okay. This can be used in dilation of large vessels for central line placement for short term, okay. If someone is fainting, okay, you can mimic this position without the bed by elevating the foot. Okay, that means you improve the venous return, force the blood again by gravity, force the blood into the cavity of the wall, the chest wall. Okay. All right. So we have a flat position again. This is flat. Okay. It can be prone or supine depending on which aspect they're facing. Okay. So prone meaning what? What is prone position?
Flat on the stomach.
Okay, they're on their stomach, right? So flat position typically for vertebral people with vertebral injuries, you want to maintain the alignment. This would be a good one. Immediately after lumbar puncture and in cervical traction, we want to put them in a supine position to minimize post-puncture headache, okay, in lumbar cases. And again, this is generally preferred by patients for sleeping. Okay. All right, we go to hand, foot, and nail care. Okay, the scale of care of the fingernails again and foot care for patients without diabetes. Okay, pay attention to that. Without diabetes or any circulatory compromise or anticoagulation therapy or bleeding disorder, is appropriate to delegate to your CNA or your unlicensed assistant personnel. Okay, please keep this in mind. Very important. Okay, in terms of delegation, and you will be tested with a lot of delegation questions again. All right. What can we delegate if they don't have? They're not diabetic. Okay. They're not taking any blood thinner. They're not on any anticoagulation therapy. They don't have any circulatory problem. Okay. This task of foot care and hand care and nail care can be delegated to your CNAs. Okay. Otherwise, if they're diabetic, if they have some neuropathic problems, okay, then we don't delegate this to the CNA. We refer them to a podiatrist. Okay, this is a foot specialist. Okay, so people with extremely hard nails, that's another one too. Okay, so diabetics on blood thinners, patients with extremely thick nail, we refer them to the podiatrist as well. Okay, that means the CNAs are not allowed to cut the nails of this patient, particularly. Okay, especially with diabetic patients. These patients are usually referred to a foot specialist, and we call them as podiatrist. Okay. This is a need to know information, so make sure you take this. If you're following me in your book or you're following me in my slide, okay, make sure you take note of this one or highlight this. All right. So these two are need to know. They are very important. All right. When you're delegating something to your CNA, okay, you give them the proper instruction. Okay. The proper use of the clippers. Okay. The use of hot or cold or warm or cold water. Okay. What do they need to report to you? Okay. Are there any skin changes that needs to be reported to me? Okay. Please let me know. Okay. Now, in as far as bed making, usually this is delegated again to our CNAs or UAPs. Okay. Make sure you're very clear in your communication whether this is going to be an unoccupied or occupied bed change. Okay. So a lot of times it's a lot easier to do an unoccupied bed making, right? Okay. There are cases where patients are bedbound, then we need to give clear instruction. Okay, the patient is bedbound, you need to do an occupied bed making on this patient. Okay. Always review the safety precautions when performing the skill. Okay. And always instruct your UAP to maintain good communication with you for any changes. Okay. Instruct the CNA to allow the patient rest periods in between. Okay. And notify you if the patient becomes fatigued. Okay. All right, some important numbers here again. What is our room temperature again? What is our range, if you can remember it?
68 to 74.
Between 68 and 74. Okay, so more magic numbers here. Okay, for a cool water tub bath, okay, the water temperature for a tepid bath is 98.6 degrees Fahrenheit. Okay, for a warm water tub bath, okay, the recommended water temperature is approximately 110 degrees Fahrenheit. Okay. And now we go to the hot water tub bath. Make sure you don't get confused again. Okay. I'm trying to make your life a little bit easy. The proper temperature for a hot water tub bath is 113 to 115 degrees Fahrenheit. Okay.
I have a question. Do we need to remember on that temperature in Celsius?
No, we'll do the Fahrenheit.
Yeah,
Okay.
thank you.
But if you're done with your lecture for the conversion, then yes, I may ask question in the Celsius. Okay. So that means you need to know you had this in your prereqs, right? The conversion.
Last game we need a calculator.
You guys still remember it?
We need a calculator to do it.
There is a built-in calculator in your ATI, so don't worry. Okay. So but anyway, I usually stick to that unless I do have some simple questions about math, about conversions, right? Okay. Hot water tub bath is not to be used for patients with neurologic disorders. Okay. People with circulatory impairment, okay, because of the risk of burns. Okay. When you have problems with your nerves, okay, that affects how fast or how slow the information would travel to your brain. Okay. So remember, all these things will always boil down to the information going into your brain. Okay. If there's a slow transmission, okay, before they can complain, oh yeah, it's too hot for me, you already burned your patient. So this is not to be used for people with neurological problems. Okay, sitz bath. Okay, I want to skip that because I have some magic numbers for you as well. But sitz bath cleanses and aids in reducing the inflammation of the perineal and the anal areas of the patient who has undergone rectal or vaginal surgery or childbirth. This is very helpful. Okay, so for some patients with inflamed private areas, this can be relieving as well to some patients. And again, this requires prescription. Okay, that means it has to be ordered by your doctor for as far as the sitz bath is concerned. Okay. Discomfort from hemorrhoids or a fissure also is relieved with the sitz bath. So if you have hemorrhoids, this can be a good intervention for the patient. Recent vaginal delivery, okay, recent vaginal surgery, this can be relieving to some patients as well. Okay. All right, going back to that hot water tub bath, okay, the benefit for putting your patients into this type of bathing, and if they don't have any contraindication, okay, is helps relieves the muscle soreness and muscle spasms. Okay, it can improve the circulation because it can pretty much dilate most of your blood vessels. Okay, not recommended for children. Okay, always caution the patients to use safety bars when they're using a hot water tub bath. Okay, no oils on their bathing. Okay, this can cause a slip. It can become slippery. Okay, check on the patients every 5 minutes, or you need, or rather, stay with your patients at all times. Okay, do not allow to remain in tub more than 20 minutes. Okay, so ideal time is 10 to 20 minutes for hot water tub bath. Again, this is a magic number. You need to know these ranges. Okay, no more than 20 minutes. The range should be between 10 to 20 minutes. Okay, as against the sitz bath, the patient can sit on a sitz bath for as long as 30 minutes. Okay, so 20 to 30 minutes for a sitz bath. Again, this might be confusing for you. Let's do that again. All right, hot water tub bath, maximum of 20, between 10 and 20 minutes of bathing. For someone who is being put in a sitz bath, allowable time is between 20 and 30 minutes. Okay, and this is usually done 3 times a day as ordered by the doctor again. Okay, this would help the inflammation in the perineal area and the anal areas of the patient. Okay, but also important, what you learn from your A&P is what is that important nerve that goes all the way to your number 2. What do we call that? Vagrant nerve that goes all over your body. It goes to your lungs, to your heart, to your gut. What do we call that nerve? Cranial nerve number 10. Anybody remember it? Starts with a letter V.
Vertebrae.
Nerve.
I can hear you.
Asking for a nerve. A cranial nerve.
Yes.
A vagus nerve. Okay? Cranial nerve number
10.
number 10. Okay? So the best way to remember this, think about Las Vegas. Cranial nerve number 10, Las Vegas. All right? So learn by association again. All right? Vegas, very close. Cranial nerve number 10. Okay? That means if the patient complains of dizziness, remove that patient right away from sitz bath. Okay? And make sure you put that patient into the bed. Why? That means you have activated the vagus nerve. Okay? And that can lead to a massive dilation of the vessels that can lead to a drop in the blood pressure. Your patient can fall, your patient can lose consciousness. Okay? So very important. If you activate your vagus nerve, that can lead to vasodilation and a drop in blood pressure. This is why some people, okay, when they hear something bad, okay, a bad news, okay, some people lose consciousness, they faint, right? Have you seen this have you witnessed this? Some people losing consciousness or passing out when they hear bad news. Okay, that's one of those nerves that gets activated. All right, it can cause a massive dilation of the blood vessels and a sudden drop of your blood pressure and then you fall. Okay, so some of the symptoms here is the patient will start to complain, I feel weak and dizzy. Okay, when you hear that word weak and dizzy, stop the bath right away, move the patient into the bed. All right.
I was wondering, I'm sorry to interrupt.
Go for it. No. You're free. I'm happy when people ask questions. All right.
Well, my question is if we could take a 5-minute break, please.
Oh yeah. Oh yeah. Okay, I forgot. It's 11 o'clock. Let's do a 10-minute break. I'll make it even better. Let's be back at 11.
Thank you.
Thank you for reminding me. I appreciate that.